Hi, this is Andrea Kane, and I'm here with you for HSC 114 Medical Terminology, where we are studying the Language of Medicine, 12th edition by Davie Ellen Chabner. This lecture video and PowerPoint is for Chapter 5, the Digestive System, for week number 3, and we will be covering Chapter 6 as well, so that will follow this one. Let's take a look at what we're going to be doing. We are going to be naming the organs of the digestive system and describing their locations and functions. Combining forms for organs will be defined, and we will learn the meaning of related terminology. We'll also be looking at signs, symptoms, and disease conditions that affect the digestive system. So let's go ahead and take a look. The digestive or gastrointestinal system, also known as the GI system, performs 4 main functions: ingestion, digestion, absorption, and elimination. Ingestion is where food material is taken into the mouth. Digestion is where the food is broken down mechanically and chemically as it travels through the GI tract. So it starts with the mouth. It's broken down using our teeth, and then it goes down and into our stomach. It's broken down chemically there, and then it goes through the small intestine, large intestine. During this process, digestive enzymes aid the breakdown of complex nutrients. Proteins are turned into amino acids, sugars are turned into glucose, and fats are transformed into fatty acids or triglycerides. During absorption, digested food passes into the bloodstream through lining cells of the small intestine. Notice that, that's the small intestine is where absorption takes place. Nutrients then travel to all cells of the body. Cells burn the nutrients to release the energy that is stored in food. Elimination is the solid waste materials that cannot be absorbed into the bloodstream are moved into the large intestine where they're concentrated and then eliminated out of the body through the anus. So the organs of the digestive system start with the oral cavity. The major parts of the oral cavity include the cheeks, lips, hard palate, soft palate, rouge, uvula, tongue, papillae, tonsils, gums, teeth, and pharynx. And this is a visual to help you see the major parts of the oral cavity. And you notice here on the right, you get sort of the terms that we are most familiar with. On the left, though, it's showing you the combining forms that match those terms on the right. So this may be a visual that's really helpful to you as you're studying. Then, as we talked about a minute or two ago, the teeth do what's called mechanical breakdown of the food. And there are anatomical terms for the parts of a tooth that include crown, root, enamel, dentin, pulp, gingiva, cementum, root canal, periodontal membrane. And this visual is the anatomy of a tooth. And it shows you the 2 basic parts, the crown and the root. And within the crown, you have several parts. And then within the root, you have from the gingiva on down through the blood vessels and nerves. Another term for swallowing is deglutition. Deglutition. That's known as swallowing. And if you look at this visual, on the left, you can see the food bolus is in green and it is moving down the esophagus. But notice here that the epiglottis is closed. It's blocking that food bolus from accidentally going down the trachea and ending up in the lungs, causing aspiration. So when someone is swallowing, their epiglottis should be closed so that it prevents the food from getting out of the esophagus and into the trachea. On the right-hand side, it shows you what happens when that food bolus is now past the epiglottis. The epiglottis now opens up so that the individual can exhale and inhale. They can breathe. And that airflow is coming through in and out of the trachea. But again, There are some patients, like stroke patients, who have difficulty swallowing. And when they have that difficulty swallowing, their epiglottis opens inappropriately and they end up with aspiration pneumonia because either food or a beverage ends up getting into, or even just swallowing saliva ends up into the lungs, which is a bad situation. So this is a really good visual here for the whole deglutition process, as well as breathing and swallowing and preventing aspiration. All right, moving on to the esophagus stomach. The parts of the stomach include the lower esophageal sphincter, the fundus, greater curvature, lesser curvature, rouge, body, antrum, pylorus, and pyloric sphincter. Pyloric sphincter. And this is a visual showing us those parts of the stomach. You can see where the fundus is at the top, the greater curvature coming down into the body, and the antrum at the bottom leading toward the duodenum, which is now part of the small intestine. So the last piece of the stomach is that pyloric sphincter. That's the last part of the stomach. When you get to the duodenum, you have moved into the small intestine. You'll want to keep that in mind. All right, so moving on to the digestive tract. We have anatomical terms of esophagus, stomach, duodenum, liver, gallbladder, pancreas, jejunum, ileum, cecum, appendix, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and anus. And this is a visual, and I grant you the words are very, very small on the screen. But if you take a look at your book, you will see this in much bigger print, and it'll be easier to see where everything falls. And this should be somewhat familiar to us after last week's review, or was it the week before, where we did the different body cavities, and we looked at the abdominal pelvic cavity. We also looked at the different regions, the abdominal pelvic regions, remember that? And then we looked at the 4 quadrants. And so this is sort of review for us, noticing that the lungs are at the top, and then you have the diaphragm, and that diaphragm really is the divider between the thoracic cavity and the abdominal pelvic cavity. And most of what happens with the digestive tract is below the diaphragm, although you do have above it the esophagus, and the oral cavity. All right, so small intestine. How does that work where it's absorbing nutrients and sending it to the bloodstream? Well, these are some visuals to help you with that. This is a cross section of the small intestine. So if you slice someone's small intestine, this is what you would see. Notice on the very inside, you see these little squiggly, almost spirally, frilly type structures called villi. If we take a slice of that and we look at it in a little bit bigger view, we see that those up and down kind of squiggly kind of structures are where on the outside you have the villus or villi, because villus is singular, villi is plural. And then within that, you have the lymph vessel in the very center. It's that kind of pale green, almost a seafoam green color. And then on either side, you have blood vessels. The red signifies the artery where you've got, or the arterial vessels where you have oxygen. They're oxygen rich. The blue signifies the venous capillaries, where they've lost their oxygen. They've given it up on a cellular level. So what you have here is in the villi, they're absorbing that, and they're passing it through to the blood that's moving through. And then the blood takes it where it needs to drop it off. Parts of the large intestine include the cecum, appendix, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and anus. And here's a visual for all of those. And it just shows you how those are laid out in the abdominal pelvic cavity. If you have trouble remembering the order of the parts of the colon, think of it as starting on the right-hand side of the body and going up. So you ascend on the right, you transverse across, you descend on the left, and then you have this S for sigmoid. And that may help you remember it. You may want to do it with hand motions or trace it on yourself or someone else, but whatever works for you to memorize that. There are also other organs in the digestive system, and these include liver, gallbladder, common bile duct, pancreas, pancreatic duct, and then we've talked about the duodenum, which is part of the small intestine. But here is a visual of that. The liver is this large purple area on the left on the screen. Then you have the stomach, and right on the upper edge of the stomach in that fundal area is the spleen. And then down below, kind of nestled in or tucked in to where the small intestine is curling around, you have the pancreas. That's the yellow here. Besides producing bile, the liver helps maintain normal blood glucose levels. It manufactures blood proteins necessary for clotting. It releases bilirubin, that's a pigment in bile, and removes toxins and poisons from the blood. It's a huge filter that does a lot of other things as well. The liver is a very critical organ to our survival. Quick quiz: what happens if bilirubin cannot leave the body and remains in the bloodstream? What happens if it can't leave and remains? Well, we know that odds are it's going to increase. If you have it and it's supposed to leave the body and it can't, what's it going to do? It's going to build up, build up, build up. So which one of these terms means excessive? That should help you figure it out. All right, the pancreas and its functions. It has endocrine functions and exocrine functions. The endocrine functions are to excrete insulin into the bloodstream to take to the cells. Its exocrine function is to excrete enzymes that go into the duodenum or the small intestine for digestion. So it's actually the pancreas. Remember where the pancreas is. It's tucked up here, right around. It's the small intestine curls right around the pancreas. So its exocrine, direct release of enzymes, is right into that duodenum to help with digestion. That's its exocrine function. Its endocrine function is to send into the bloodstream the insulin. So let's talk about how food moves through the GI tract. A simple way to think about it is it moves through the oral cavity and exits through the anus. And this helps if you need to see the path. So food enters the oral cavity, and at the same time it's in the oral cavity, you have salivary glands excreting saliva to help break down chemically the food. The food moves through the pharynx into the esophagus and then into the stomach. While it's in the stomach has acids that also chemically break down the food. And of course, when the food's in the oral cavity, you have the mechanical breakdown through your teeth. When it moves from the stomach to the duodenum, that's where things start to get exciting, because you have the pancreas that's excreting these enzymes to continue that breakdown and digestion. But you have the liver that excretes bile into the gallbladder, and the gallbladder sends bile into the duodenum. That also helps with that digestion. And then from there, it moves to the jejunum and the ileum. Now, the duodenum, jejunum, and ileum are all parts of the small intestine. So if you're wondering which pieces of this are small intestine, it's duodenum, jejunum, and ileum. Then it moves into the large intestine here, and this starts with a cecum. So make sure that you know the large intestine starts with a cecum and then moves ascending colon, transverse colon, descending colon, sigmoid colon to the rectum. The rectum is the end of the large intestine. So watch out for that. You need to know it starts with a cecum, ends with a rectum. And then from the rectum, the waste is pushed through the anus and the feces leave the body. Which term is the first part of the large intestine? And I kind of emphasized this, so hopefully you remember it. Which term means swallowing? Okay, now we talked about that process, and I mentioned that word a few times. Hopefully you can remember what it is. All right, moving on to vocabulary. We have some terms here. We have absorption, amino acids, amylase, anus, appendix, bile, bilirubin, bowel. Canine teeth, also known as cuspids or eye teeth. Cecum, colon, common bile duct. And notice here it reminds you that it's also called the choledochus. And you'll need to know that the common bile duct is choledochus because when we start getting into terms, you can imagine what the root word is there, right? Defecation, deglutition, that was the answer to the one above about swallowing. Dentin, digestion. Duodenum, elimination. Emulsification, enamel. Enzyme, esophagus, fatty acids, feces. Gallbladder, glucose, glycogen, hydrochloric acid. Also, or HCl. You may see it as HCl, hydrochloric acid. Ileum, incisor, insulin. Jejunum, lipase, liver, lower esophageal sphincter. Mastication means chewing. Molar teeth, palate, pancreas. Papillae, the singular is papilla. So papilla is singular, papillae is plural. Parotid gland, peristalsis, pharynx. Portal vein, protease, pulp, pyloric sphincter. Pylorus, rectum, rouge, saliva. Salivary glands, and notice that there are several. You have parotid, sublingual, and submandibular. Sigmoid colon, sphincter, stomach. Triglycerides, uvula, and then we went over with these little villi, that's singular, or villi is plural, the singular is villus. So if it's just one itty bitty projection, that's going to be a villus. If you're talking about all of those that went around that area of the small intestine that we were looking at, and it's more than one, it's going to be villi. Okay, so let's get into those combining forms. So ano, appendo, appendiso. So notice there's two for appendix. Bucco, ceco, celio, kilo. Look at how close kilo and celio are. You want to be really careful with those two. Cholecysto and choledocho. Remember I told you you kind of have to watch out for that to make sure that you know what those are because they are different. The gallbladder is not the common bile duct and the common bile duct is not the gallbladder. Colo and colano. Notice there's two for colon. Denti, tooth. Oh, our combining vowel there is an I, not an O, so you want to make note of that. Duodeno, entero, esophago, fascio, gastro, gingivo, glosso, hepato, ilio, jejuno, labio, laparo, linguo, mandibulo-odonto. Oro, palato, pancreato, peritoneo, pharyngeo, procto, pyloro. I want to go back to procto. Notice that that's two sections together. It's two terms together. It's the anus and the rectum. So if you see procto, it's not just one, it's both. Pyloro, recto, coeladno. Sigmoido, stomato, uvulo. Amylo, bili. Oh, see, we got another I there for bili. Bilirubino, chole, chlorohydro, and look, with chole, you have an E as a combining form, which is very, very rare. And it means the same as bili. So watch out for bili and chole, those both mean gall or bile. And they both have something other than an O as their combining form. Chlorohydro, gluco, glyco, both mean sugar. Gluco and glyco both mean sugar. Glycogeno means glycogen, so that's not sugar. It's an animal starch. Lipo, litho, proteo, pio, cialo, steato. Now some suffixes. Ase, chesia, easis, prandial. And again, easis always is going to be abnormal condition, not just a condition, but abnormal. So now they want us to talk about anastomoses. There are three different types that you will see. One is end-to-end, another is end-to-side, and the last one is side-to-side. And this is where you're taking, where there's been some type of removal of a section, usually of an intestine, whether that's small intestine or large intestine. They've taken a piece out. They've excised that piece. Now they're putting it back together again. They're rehooking those cut ends up. And how they're doing it is either end to end, end to side, or side to side, and it's called an anastomosis. All right, which term means inflammation of the lip? Inflammation of the lip. Well, the first thing is you're going to look for inflammation, right? You're going to look for that suffix that means inflammation, and then you're going to go looking for the root word that means lip. And I know that you can get this. All right, so what can go wrong? And that's really what pathology is all about, disease, or what can go wrong with the digestive system. Well, there's anorexia, a loss of appetite, ascites, abnormal accumulation of fluid in the abdomen, borborygmy or borborygmus, that's where you've got a rumbling or gurgling noise that's produced by the movement of gas, fluid, or both in the GI tract. That's where if you hear somebody's stomach kind of growling or gurgling or making some kind of very loud noise other than out of hunger, that's probably what it is. Constipation, difficulty in passing stools. Diarrhea is the opposite, where there's frequent passage of loose watery stools. Dysphagia, and notice the G, dysphagia. That's difficulty swallowing. If this is an S, if that G were an S, it would mean difficulty speaking. So you have to be really careful because they sound so much alike. Eructation is a fancy name for expelling gas through the mouth, also known as burping. Flatus is gas expelled through the anus. Hematochezia is passage of fresh, bright red blood from the rectum. Jaundice, or icterus, is yellow-orange coloration of the skin and whites of the eyes caused by high levels of bilirubin in the blood. If someone has jaundice, there's something wrong with the liver. Almost always. That's just a dead giveaway. Melena is black tarry stools, feces containing digested blood. So going back up here, when you have hematochezia, there's a good chance that someone might have bleeding hemorrhoids because the fresh bright red blood is coming from the rectum. So they may have a cancerous tumor, or they may have bleeding hemorrhoids, something like that, but it's coming. Hematochezia means it's fresh, it's happening toward the end of the digestive tract. Melena, on the other hand, means that something happened way back, possibly in the stomach, and it's got some digested blood in there. So it's either the stomach, maybe esophageal varices, but typically that's going to be when you have vomiting of red blood. But it could be that someone's got a stomach ulcer. It could be that there's a cancerous lesion in the small intestine when someone has melena. Nausea is that unpleasant sensation in the stomach with a tendency to vomit. Steatorrhea is fat in the feces where there's frothy, foul-smelling fecal matter. Things that can go wrong with the oral cavity and teeth. There's aphthous stomatitis. Aphthous stomatitis, that's a hard one to say. Inflammation of the mouth with small painful ulcers. Dental caries is tooth decay. Herpetic stomatitis is an inflammation in the mouth due to the herpes virus. Oral leukoplakia is white plaques or patches. Periodontal disease is inflammation and degeneration of the gums, teeth, and surrounding bone. What can go wrong in that upper gastrointestinal tract or upper GI? One of the things that can happen is achalasia. Achalasia. That's where the lower esophageal sphincter will not relax. It's constantly staying tight, and they show you that here. That when this sphincter, the lower esophagus or esophageal is a better correct term, lower esophageal sphincter fails to relax, it's going to result in food backing up and no peristalsis. And so what they have to do is go down there and push whatever's blocking it through, if that's a food bolus, or they may have to go in and actually stretch the esophagus so that the narrowing is dealt with. Other things that can go wrong in the upper GI tract are esophageal cancer, gastric cancer, esophageal varices. I mentioned that earlier. These are swollen varicose veins at the lower end of the esophagus. They're called esophageal varices. They can happen from a number of different things, but one of the common ways that esophageal varices occur are in patients who have severe alcoholism and are actively drinking over a long period of time. They develop these and they start bleeding, and it can be a very serious condition. GERD. You may have heard of GERD, gastroesophageal reflux disease. This is where solids and fluids return to the mouth from the stomach. Peptic ulcer is where an open sore or lesion of the mucous membrane of the stomach or duodenum occurs. Hernia. We talked a little bit about a hernia a couple of weeks ago, but we looked then at more cystoceles and rectoceles. But you can also get hernias occurring in the inguinal area. In fact, that's one of the most common areas. Also, there's what's called the hiatal hernia, and that's another really common one too, that affects right at the esophagus, that a hernia develops there. It's also known as a diaphragmatic hernia, and it has to be reduced and taken care of through surgery. With an inguinal hernia, sometimes it can be reduced by just pressing on the area and it'll go back down through, but a lot of times it will require a surgical procedure to deal with it. And so this is a visual of inguinal hernias, when it's direct or whether it's indirect. Other things that can go wrong in the lower GI tract include an anal fistula, where you have abnormal tube-like passageway near the anus, colonic polyposis, and this is better known as colon polyps. These protrude from the mucous membrane of the colon, and some of them can be cancerous. Not all, but some can. And so typically, if a doctor is doing a colonoscopy and they run across polyps, they try and remove them. And this is a visual of colorectal cancer or adenocarcinoma of the colon, rectum, or both. Moving on, hope you weren't eating or having a snack while we were looking at that. But moving on, small and large intestines, things that can go wrong include Crohn's disease and diverticulosis. Crohn's disease is a particularly nasty condition where you have chronic inflammation of the intestinal tract. And this is something that can erupt and cause significant problems, hospitalization for patients. It can be controlled sometimes through medication and diet, but not always. Diverticulosis is an abnormal outpouchings or outpouchings, however you want to pronounce that, abnormal side pockets develop in the intestinal wall. And you can see down here what that would be like, where these little pockets kind of end up on the sides. Other things, through infection, it can be dysentery. You used to hear a lot about this in the last couple of centuries in war and poverty-stricken areas, that people would end up with some type of intestinal condition. It could be a parasite, it could be an infection, a bacterial infection, it could be something like that, and it's called dysentery. Hemorrhoids are swollen, twisted varicose veins in the rectal region. Ileus is failure of peristalsis with resulting obstruction of the intestines. And sometimes an ileus happens just after someone's had abdominal surgery, and it's not the fault of the surgery. For whatever reason, in some people, this develops after abdominal surgery, or especially intestinal surgery. And some people, they don't have a problem with it, but it does develop. And sometimes someone will get an obstruction, and the obstruction is dealt with, but the intestines are not ready to get back to work. And so it's like they're taking a long extended break, and they have to get that moving again. Inflammatory bowel disease, this is inflammation of the colon, the small intestine. The inflammatory bowel disease is different than Crohn's disease. I mean, Crohn's disease is a very specific type of inflammatory bowel disease. This is more of a generic kind of category, umbrella category, you might say. Intussusception. This is where the intestines decide they're going to telescope. They're going to push out in directions they have no business doing. Irritable bowel syndrome, I think, didn't we just, we talked about inflammatory, but there's also irritable bowel syndrome, and that's GI symptoms that are associated with stress and tension. Ulcerative colitis is another type of bowel issue where you have chronic inflammation of the colon, and it develops into ulcers. So you have the ulcerative colitis. Volvulus is where the intestine twists on itself, and this is very serious. If someone has volvulus, they need to get to the hospital immediately for emergency surgery, because when that intestine twists like that, it cuts off blood supply, and very quickly intestines can start dying and have to be cut out and removed. And if they're not caught in time, they can end up with an abscess in the abdomen, and it can really be a life-threatening situation. So volvuluses are nothing to be patient with. Other things that can go wrong with the liver, gallbladder, and pancreas include cirrhosis, a chronic degenerative disease of the liver. And cirrhosis is not always alcoholic. Many cases of cirrhosis involve individuals who have never had any alcohol. So be very careful if you think about cirrhosis that you're not linking it to alcohol, because that is not the case in many instances. Hepatocellular carcinoma is liver cancer. Pancreatic cancer is a malignant tumor of the pancreas. And by the way, people with liver cancer and pancreatic cancer diagnoses, typically the survival rate is less than 5%. It is very, very low. Pancreatitis is an inflammation of the pancreas. Viral hepatitis is a viral attack that causes inflammation of the liver. So cholelithiasis. Cholelithiasis, that means gallstones in the gallbladder. And this is a picture of a gallbladder. And you can see these stones in here. Granted, they've been broken up, obviously, but you can see they're pretty significant when you look at the size of the gallbladder. So that is chapter 5. I will be back shortly to talk to you about chapter 6. Thanks.